Yo Gary, how was your weekend?
Now is really not the time, John.
Come on, what's wrong?
I went to the doctor for a physical, got some tests done, and the results came in.
What were the tests for?
Well, they noticed some white areas on the tips of my toes and fingers. So they did a test called anti-nuclear antibodies test and a test called erythrocyte sedimentation rate.
What did the results show?
They determined that I have Raynaud's disease.
What do those tests look for?
Well, the anti-nuclear antibody test is used as a primary test to help evaluate a person for autoimmune disorders that affect many tissues or organs throughout the body. But the erythrocyte sedimentation test measures how quickly erythrocytes settle in the bottom of a test tube that contains a blood sample. Normally, red blood cells settle pretty slow, but a faster than normal rate could mean inflammation in the body.
Wow, that's intense. So explain to me what exactly the Raynaud's disease is.
Do I really need to talk about this? Can't you just look it up yourself?
Gary, man, I'm just trying to understand what you're going through, so go on, tell me about this disease.
Okay, well, like I said before, it is a fairly rare disorder. It most commonly affects the blood vessels in your toes and fingers. When this happens, blood isn't able to reach the surface of the skin, which makes the affected areas turn white and sometimes blue. These affected areas could feel numb or cold in certain circumstances.
Hold on, so you're telling me that the tips of your fingers and toes are a white color, and you can't feel them? Wait. Is this disorder life-threatening? Like, can you die from this?
No, do not worry, this disorder is not life-threatening. But yes, my toes and fingers do appear to be white. See? Look at them, John, look at them.
Oh, yeah, they do look white. I've never noticed that. Well, that's a relief. I don't know what I would do without my best bud Gary.
Thanks, dude. I feel the same way about you.
Wait, so how do you even get this disorder? Or are there no known causes?
Exactly what causes Raynaud's is unclear. But hyperactivation of the sympathetic nervous system is known to cause an extreme narrowing of the blood vessels, known as vasoconstriction.
Hold up, can you dumb that down for me? Thanks.
Wow, really? Okay, fine. Well, actually, all that meant was vasoconstriction is a possible cause.
Okay, whatever. So where do you go from here? Like, are there any treatments that you can do to get rid of it? Or is this something that you aren't able to get rid of?
Well, there's no cure, but there are ways to manage symptoms. For mild forms, just covering the exposed skin can help. Or soaking the affected areas in warm water, which may help prevent them from worsening. And in moderate to severe cases, medication may be necessary. So like, alpha-1 blockers, the hydropyridine calcium channel blockers, and other vasodilators. These all basically relieve the symptoms or pain. So, since I have moderate Raynaud's disease, I am being prescribed some medication. I picked them up today.
Well, that sucks that you can't get rid of it. But at least there are medications to help relieve some of the symptoms. But anyway, thank you for telling me about Raynaud's disease. At least I am able to understand what you're going through.
No, thank you, John, for wanting to learn more. I feel a lot better after talking about it.